Somewhere in this country, right now, someone is being wheeled into an emergency room. Their blood pressure is so high that the machine on the wall rechecks itself twice before it believes what it is reading. And when the paramedics ask the question they always ask, "Were you taking your blood pressure medication?" the answer is almost always yes. Every single day, faithfully, sometimes for years. That is the part that should scare you. Not that they were not taking it, that they were, because here is what almost nobody tells you. Taking your pill is not the same thing as taking it correctly. And the gap between those two things is exactly where people end up in an ambulance. More than half of Americans being treated for high blood pressure are taking medication for it right now, and yet only about 1 in 4 of them actually have their blood pressure under control. Read that again, 1 in 4. Let that sit for a second. Most people are doing something. Most people are still not okay, which means many people watching this right now may recognize at least one of these mistakes in themselves without ever having connected it to their numbers. So today, we are opening a case file. 7 quiet mistakes, ranked from the one that just annoys your doctor to the one that can put you in an ambulance without a single warning sign. Stay to the end, because mistake number 2 is the one almost nobody thinks to mention at their appointment. And the final one is not really a mistake in judgment at all. It is a mistake in what a lot of us, myself included, thought we already knew. I am Dr. William, 15 years in practice, thousands of patients between 60 and 90. And if there is one thing 15 years has taught me, it is this. The people who end up in trouble are rarely the ones who ignore their diagnosis. They are the ones who are trying, just doing 1 or 2 things wrong without anyone, including them, ever noticing. Blood pressure medication does not work the way most people picture it. It is not one dial turning a number down. Depending on what you have been prescribed, it relaxes your blood vessels, slows your heart rate so it is not working as hard every time it beats, or tells your kidneys to release extra fluid and sodium, so there is simply less volume for your heart to push around in the first place. Every one of those jobs depends on something almost boring in how simple it is: a steady, predictable amount of the drug sitting in your blood hour after hour. Not a full dose today and a skipped one tomorrow. Not a normal dose sitting next to something in your coffee, your salad, or your vitamin drawer that cancels half of it out before it ever gets the chance to work. Steady, quiet, consistent. That is the whole system, and it is exactly where these 7 mistakes get in, one at a time, none of them loud enough to notice on their own. Let us open the file. Mistake number 7, consistency. It is not one thing, actually. It is 3 versions of the exact same failure. Keeping a steady amount of medication in your blood. Frank was 71, retired, meticulous, loved working on his lawn, but every afternoon his ankles swelled like balloons, and every night he woke up 4 times to urinate. It had been going on for months, and he had gradually started to assume this was just what 71 felt like. "I take everything at 7 a.m. with breakfast," he told me. "That way I never forget." Sounds flawless. Here is what was actually happening. Imagine pouring water into a dry sponge all afternoon, then wringing it out the moment you lie flat. That was Frank. His water pill pulled fluid out during the day, but sitting in his recliner, let gravity pool it straight into his legs. The second his head hit the pillow, that fluid redistributed back into his bloodstream, and his kidneys worked all night trying to catch up. We moved that 1 dose, added 20 minutes of legs up in the evening, and within days, he was sleeping through the night. His morning numbers dropped 15 points without a single change to the prescription itself. Worth pausing on. Frank's fix was not about finding some universally right hour. Water pills are the exception here, because moving the dose changed fluid and gravity, not because 1 hour beats another. Keep that in mind. It matters again soon. George, 68, had a different version of the same problem. He told me he was pretty good about his pills, maybe missed one here or there, and when he did, he would just take an extra one the next morning to catch up. 2 doses, 2 days, evens out. Made sense to him. Most people think a missed dose is a wash, owed and repaid, like paying off a debt after the fact. Think of it less like a bill and more like a thermostat. It only works if it is reading a steady temperature in the room, not a stack of yesterday's missed adjustments crammed into today's setting. Large studies tracking Americans on blood pressure treatment have found that barely half stick to their prescription exactly as written over the long run. Sometimes forgetfulness, sometimes cost. Doubling up does not solve either problem. It just adds a new one. A sudden, unpredictable drop in blood pressure, dizziness, sometimes a fall, the very thing the medication was supposed to prevent. Linda, 71, took inconsistency to its most extreme version. She stopped taking her medication altogether for almost 3 weeks without telling anyone, including me. Her readings had been perfect for months straight. I figured my body finally fixed itself, she told me, almost proud of it, like she had graduated from something. Most people think a normal reading means the underlying problem is gone. It is the opposite. Your numbers are normal because of the medication, not instead of it. When you stop suddenly, your body does not simply drift back to where it started. In a lot of cases, it overcorrects hard. Blood vessels that had been relaxed for months tighten back up all at once, and blood pressure can spike higher than it ever was before treatment began. There is a name for this, rebound hypertension, and depending on the drug, it can start within days, not weeks. Linda's blood pressure, 3 weeks later, was higher than it had ever been on her chart. 3 patients, 3 different habits, 1 shared cause. The medication only protects you when it stays steady in your blood, and steady does not always mean the same hour. For most blood pressure medications, it is less about which hour you pick and more about never abandoning the one you are on. We will come back to why that matters more than most doctors, myself included, used to think. So that is mistake number 7. Solved. Case closed. Except there is a problem. Fixing the clock and the consistency changes a great deal, but it does not explain everyone. Sometimes the pill is not failing because of when or how often you take it. It is being sabotaged before it ever reaches your blood. The next suspect is not timing. It is chemistry. Mistake number 6. Calcium, iron, magnesium, even a basic antacid. They do not just sit passively next to your pill. They bind to it, chemically, like wet cement wrapping around a key before it ever reaches the lock. For certain blood pressure medications, taking it and a calcium supplement within minutes of each other means a meaningful portion of that dose passes straight through your body, unused, not because the drug is weak, but because it never got the chance to work. The fix costs nothing. Your pharmacist may simply recommend spacing mineral supplements several hours from your prescription. Here is where it gets stranger, though. What if there is no supplement anywhere near your pill, stomach completely clean, and it still loses half its power? Now the investigation gets stranger. Mistake number 5 is not the medicine. It is how the medicine is absorbed. Which patient absorbed more medication? Picture 2 patients, same morning, same diagnosis, same pharmacy. Patient 1 swallows her pill with a full breakfast. Patient 2 swallows the identical pill on an empty stomach, rushing out the door. Same drug, same dose, 2 completely different outcomes by dinner. For some blood pressure medications, food acts like a slow-release valve. The difference between the drug spreading evenly across 12 hours or hitting all at once and leaving the heart unprotected by evening. Confusingly, other blood pressure drugs work the opposite way. Food can block them almost entirely. Weakness in the afternoon, dizziness at lunch, a pressure surge right before dinner. It is not the disease getting worse. It is an absorption instruction nobody ever read out loud. If your bottle does not specify with food or without, ask your pharmacist. For certain drugs, it genuinely changes how much of the dose your body uses. Then we discovered something nobody expected. Mistake number 4 is something you eat every day, something you are sure is healthy, silently working against the medicine from the inside, and it is the one I see most often in people who think they are doing everything right. Gloria, 66, loved grapefruit for breakfast, half of one most mornings, convinced that more fruit could only ever be a good thing for a woman her age. Most people draw a hard line between medication and everything else, as if only pills in orange bottles are powerful enough to matter. Your body does not draw that same line, and it never has. Grapefruit blocks a specific enzyme in your liver. That enzyme is responsible for breaking down certain blood pressure medications, particularly the ones that relax your blood vessels directly. Block it, and the drug does not get broken down at the normal rate. It builds up instead, sometimes reaching 3 to 5 times the level your doctor actually intended. That is not a stronger dose working harder for you. That is an accidental overdose delivered at the breakfast table without anyone noticing. A daily ibuprofen for aching knees does something quieter, but just as real. Common anti-inflammatory painkillers make your body hold on to extra fluid while blunting the effect of some of the most commonly prescribed blood pressure medications. And the rise tends to be larger in people already taking certain blood pressure drugs like beta blockers. Cold and allergy medicine hides a second version of the same mistake. A decongestant narrows blood vessels on purpose to clear a stuffy nose, and it does not know the difference between the blood vessels in your nose and every other blood vessel in your body. None of this shows up as a warning label on a fruit bowl, a tea box, or a bottle of painkillers, which is exactly why it slips past so many careful people. The mistakes still ahead are the ones I consider the most surprising on this entire list, and the ones almost nobody brings up at their own appointment. Let me prove something to you. Mistake number 3 is not about a failing pill at all. It is about a diagnosis that was never real in the first place. A few facts, and you will never measure the same way again. A cuff placed over a sweater sleeve can add roughly 10 points to your reading. Crossed legs, another 8. A cup of coffee combined with a stressful conversation or the morning news, another 10 on top of that. Stack all 3, and a genuinely normal blood pressure can look like it is dangerously out of control, leading to a dose increase for a number that was never accurate to begin with. Bare arm, feet flat on the floor, 5 quiet minutes before you start. That is the whole fix. That leaves only one explanation. Mistake number 2, the measurement is real, the routine is perfect, and your own body has gradually changed the rules on you. It is also the one almost nobody thinks to mention to their doctor at all, because on paper it looks like exactly the right thing to do. Walter, 70, switched to a potassium-based salt substitute after his wife read that cutting sodium was good for his heart. He sprinkled it on everything for about 3 weeks, before a strange tingling in his hands sent him to urgent care. Here is the frustrating part. For most people, that swap genuinely is a good one. One major trial found it meaningfully lowered strokes and heart events across the general population. It is not a scam. It is not marketing. But Walter was not the general population, and neither are millions of people on his specific type of medication. He was taking a drug that already helps his body hold on to potassium, as part of how it protects his heart and kidneys. Add a steady stream of extra potassium from every salted meal on top of that, and it can build up to dangerous levels, muscle weakness, an irregular heartbeat, and in rare cases, something far more serious than tingling fingers. The tingling in Walter's hands was not nothing. It was his body's earliest warning. Susan, 62, ran into the same blind spot from a completely different direction. She had taken the same blood pressure pill for 9 years, 120/70, like clockwork. Then, without changing a single habit, her pressure crept up, her legs swelled, and she felt drained all the time. Her doctor assumed her hypertension was simply getting worse with age and raised the dose. That made things worse, not better. Nobody had checked her kidneys. As we age, organ function shifts gradually, without announcing itself. Her kidneys were clearing the drug slower than they used to, so her original dose was already accumulating in her system. Doubling it did not correct her pressure, it overloaded her. A yearly kidney and liver panel is the entire fix, one blood draw a year to make sure yesterday's safe dose is still today's safe dose, and one short conversation before any healthy swap is all it would have taken for Walter, too. That is Walter and Susan. Mistake number 2, solved, which brings us to the last one on this list. And this one is not really about the medication at all. It is a mistake in what a lot of us, myself included, thought we already understood. For years, one widely reported study suggested that taking blood pressure medication at bedtime instead of in the morning dramatically lowered the risk of heart attack and stroke. It made headlines and made its way into patient handouts across the country. Plenty of well-meaning doctors, myself, early in my career, among them, started recommending it to almost everyone. Then a much larger trial came along, tens of thousands of patients, tracked for years, deliberately split between morning and evening dosing. The results surprised almost everyone in the field, myself included. No meaningful difference at all in heart attacks, strokes, or deaths between the two groups. Looking back, that is what actually clicked for me over the years. The people who struggled were never the ones taking their pills at the supposedly wrong time. They were the ones switching, morning one week, evening the next, because they simply forgot. The science was never about finding the one magic hour. It was about picking any hour and refusing to abandon it. But there is something even bigger than timing, because everything we have covered so far was never really the disease. It was the warning light. High blood pressure rarely causes pain. It does not announce itself while it is damaging your blood vessels. Sometimes the first real symptom is a stroke, heart failure, or kidney damage that happened while you felt completely fine the whole time. And the most dangerous version of all happens while your eyes are closed. A pattern called non-dipping, where blood pressure that is supposed to fall by 10 to 20% overnight simply does not. Non-dipping is not a disease of its own. It is a warning light with a hidden cause, and it has one more often than anyone expects. Harold, 70, had excellent daytime readings, 120/75, every single time he checked, for years. His doctor had no reason to worry, but Harold kept waking up, gasping for air, propping himself up on 3 pillows just to breathe, blaming it on his age, his weight, a bad mattress, anything but his heart. Here is what nobody had checked. In a healthy person, blood pressure naturally drops 10 to 20% during sleep. It is the only real rest your cardiovascular system ever gets. Harold's was not dropping. It was surging every night for years, not because his medication had failed, but because undiagnosed sleep apnea was quietly canceling out its effect while he slept. Every time his airway collapsed, his brain triggered a jolt of adrenaline that spiked his pressure while he lay there, unaware. 8 hours a night, his heart ran a quiet marathon he never felt and never remembered by morning. Shortness of breath lying flat, morning headaches that fade by noon, waking up exhausted after 8 full hours in bed, no matter how early he went to sleep. None of it was just getting older. It was the signature of a heart that had never actually been allowed to rest, not once in years. By the time we found it, Harold had been protected all day and unprotected all night for longer than either of us wanted to think about. It did not start the day his readings finally spiked. It started months earlier in some completely ordinary week when 3 pillows quietly became 4, and nobody, including Harold, thought it was worth mentioning at his next appointment. So there are the 7. Taking it inconsistently, the wrong routine, a doubled-up dose to catch up, or stopping altogether the moment the numbers finally look fine. A calcium tablet trapping the dose before it is absorbed. A meal rule nobody explained. Common painkillers, decongestants, and anything labeled natural, canceling out the pill sitting right next to them. A blood pressure cuff placed over a sleeve, adding numbers that were never real, kidneys that change the rules with age, and a night nobody was watching. None of these, on their own, will show up on a lab report with your name circled in red, which is exactly why they are so easy to miss year after year. Your medication only works as well as the small, unglamorous habits sitting around it. The tragedy is not that these mistakes are complicated. It is that they are so quiet, so reasonable sounding in the moment, that almost nobody thinks to ask about them until something has already gone wrong. The good news is every single one of these 7 is entirely fixable, and usually in one short conversation with your doctor or pharmacist. Somewhere tonight, someone will wake up convinced their medication has stopped working. Maybe it has not. Maybe the medication has been working all along. Maybe it is everything around it that failed. Make sure that person is not you. Everything in this video reflects general, well-established guidance in blood pressure management. It is not a diagnosis, and it is not a personal treatment plan. Please talk with your own doctor or pharmacist about your specific medications and health history, supplements included. Tell me in the comments which of these 7 hit closest to home. If this helped, subscribe and send it to someone managing their blood pressure right now. Take care of yourself. You are worth the effort.